This is Dr. Mona Orady, and I'm a minimally invasive gynecologic surgeon at Dignity Health Medical Group in San Francisco. And I'm presenting the highlights session for Day 3 of MIS Week 2017. This is the highlights of the Spotlight session, which are TED-like talks that are presented at MIS Week by the SIG Special Interest Group updates every single year. First, Dr. Jessica Ibaz-Milano presented a summary of hysterectomy and SILS, SILS, single incision laparoscopic surgery, and she discussed how SILS offers improvement in return of bowel function when compared to traditional laparoscopy. She also discussed about different SILS applications for appendectomy, colectomy, and cholecystectomy. Then I, Dr. Mona Orady, presented a presentation about the true human impact of robotic surgery. In other words, how robotic surgery has affected the humans involved, i.e. the surgeons as well as the patients. For the patients, they have been allowed to have minimally invasive surgical techniques performed, extending the ability of minimally invasive surgery to complex procedures that would have otherwise required a laparotomy. As well as for surgeons, not only have we been able to offer our patients more minimally invasive techniques for more complicated procedures, but we're also able to perform these procedures in a less physically demanding way. In other words, we have more ergonomic seating and more ergonomic ways to perform the surgeries so that surgeons have less injuries and patients are happier with their outcomes. At the end of the day, the aim is to have a happy patient as well as a happy surgeon, because a happy patient will make a happy surgeon. Then Dr. Gustavo Stringel presented a core competencies update from the American Board of Surgery and discussed the different educational principles, including validity, reliability, practicality, and relevance, and said that most new plans always include simulation, as this has become a very important way for both education and assessment. And he reviewed the new MOC requirements and the changes coming in the near future. Then Dr. Jessica Ibaz-Milano discussed a discussion about the bridging the gap of women's underrepresentation in surgery, and discussed how after having a trip as faculty to an Asian country where female faculty are not the norm, how she was treated as if she was a male faculty. She told the story of how she was given a necktie as a faculty gift, as the assumption was that all faculty are male. And she said that we have to understand that we will always carry these issues forward, and we have to create a more friendly environment for women surgeons and faculty. After this, Dr. Eric Singer discussed cytoreductive surgery for GU malignancies, and he discussed how metastatic disease for GU malignancies represents a significant issue for our aging population, and that there's probably a role for cytoreductive surgery for appropriately selected patients with these kinds of malignancies. However, better designed prospective trials led by surgeons to understand the benefit of these surgeries need to be performed. Dr. Konstantinos Frantidenzes discussed the laparoscopic revision of failed bariatric procedures, including the incidence of bariatric surgery failure that is increasing. He said that for these types of complex procedures, a team approach really needs to be taken to identify patients that are appropriate for these types of procedures, and that extensive surgical planning with both a GI doctor, surgeon, radiologist, psychiatrist, and nutritionist needs to be done. Although revisions are possible, it is always important to be prepared for the worst during redo operations. After this, Dr. Arthur Rawlings discussed informed consent from an American perspective, and discussed that it's even though you may have a 3 or 4 page informed consent page, this does not necessarily mean that informed consent was obtained, that the real emphasis needs to be on talking with the patient about what the true nature of the surgery is, what the magnitude of the risks are, the probability of the risks, the imminence of these risks, and how the surgery is supposed to help the patient, so that the patient can understand what available alternatives are and truly be informed in terms of their consent, not just signing a 3-page or 4-page informed consent paper.